Hello, welcome to Let's Talk Retirement, presented by Robert Javens Financial Advisors. Hello, I'm Bob Javens. We help our clients build strategies that work towards securing their financial future by using a goal-oriented, advice-driven approach in a way that best fits their priorities and objectives. In this presentation, we will discuss how to build a retirement strategy, Social Security retirement benefits, health insurance in retirement, and how to schedule a personal consultation. At Robert Javens Financial Advisors, we take a goal-oriented approach to building a retirement strategy. We discuss your lifestyle goals, your financial goals, your priorities and objectives, and your personal timeline. What kind of lifestyle do you envision for your retirement? Will you travel more, spend more time with grandchildren, take up new hobbies, volunteer for your church or favorite charity? After setting realistic goals, we need to consider if they are affordable. We start by making a written monthly budget for your current income and expenses, then how that monthly budget will transition into your retirement picture, projecting what income it will take to meet your retirement goals. After setting goals, we develop your strategy to achieve those goals, setting priorities and objectives now to be confident that your income, savings, and investments can carry you through your retirement years. Where do you see yourself 5 years from now, 10 years from now, or even 20 years and beyond? Creating a personal timeline varies with each person depending on the goals you have set. After you have set some goals and objectives, we analyze the data starting with your current financial situation. Do you have an emergency savings? What have you saved for retirement? What is your income and your debt? At Robert Javens Financial Advisors, we will begin to build a sound retirement strategy tailored towards you. People need help to build a sound retirement strategy. Think about it. You consult a doctor for your physical health, a dentist for your oral health, an architect or contractor if you're building a house. It just makes sense to contact an expert in financial advice and planning to help you build your retirement strategy and to help you implement that strategy. Next, we will discuss the value of a fiduciary advisor. What is a fiduciary advisor? Not all financial advisors are held to the same standards and requirements. Selecting a financial advisor who is a fiduciary means that he or she will always be working in your best interest. A fiduciary is held to the highest duty known to law and the highest standard of care. The primary responsibilities and duties of a fiduciary are duty of care and duty of loyalty. As a result, this is what you can expect as my clients. An ongoing relationship to continue to monitor your assets. Sound advice that has been carefully developed and is in your best interest. As a fiduciary advisor, my clients' needs always come first.
Hello, my name is Patricia Schuster, and I am the Social Security consultant with Robert Javens Financial Advisors. In this next segment, I will be talking to you about Social Security retirement benefits. Social Security retirement benefits are a cornerstone in your retirement strategy. I will discuss how to set up and use a My Social Security account, how to determine your insured status, how your monthly benefit is computed, when to start your benefits, and how to apply. The official Social Security website at www.socialsecurity.gov is an important tool to use in preparing your retirement strategy. The first thing you should do is to set up a My Social Security account. From there, you can review your Social Security statement and the estimate of your benefits. It is important to review your yearly earnings record to make sure that you have received credit for all of your earnings. If any year is incorrect, you should contact your local Social Security office to have it corrected. It is also important to remember that the estimate of benefits is based on the premise that you will be continuing to work like you have been up until the age of the estimate. For example, your full retirement age estimate assumes you will continue working until your full retirement age. If you retire early, you should contact Social Security to get a more accurate estimate or schedule an appointment with me for a personal consultation. After creating your My Social Security account, you can also get an estimate for spouse's benefits. Simply click on the link and follow the instructions. You must be fully insured to be eligible for Social Security retirement benefits. This means you need 40 credits or 10 years of work over your lifetime to be fully insured. There are special rules for survivor's benefits when the worker dies young and for disability benefits. In 2025, you must earn $1,810 in gross wages or net profit in self-employment to earn 1 credit, and you can earn 4 credits in a calendar year. You must be at least age 62 for the entire month to qualify for retirement benefits. So if you turn 62 on the 1st or 2nd of May, for example, you will get a check for May. Checks come the following month for the month before, so the check for May comes in June, and so on. If you were born the 3rd of the month or later, you would not get a check for the month you turned 62, but for the following month when you are 62 for the entire month. And finally, you must be retired in order to collect. There is a test to determine if you are considered retired. At some point, Congress decided that a worker did not have to be completely retired to get benefits, so they enacted a retirement test. There is a yearly limit each year on what you can earn in gross wages or net profit in self-employment. This applies to the worker and to anyone else receiving auxiliary benefits. In 2025, a retiree under full retirement age can earn $23,400 and still receive all of their benefits for the calendar year. If they exceed that amount, $1 is withheld for every $2 that they earn over the limit. There is a special monthly test that applies only for 1 year, usually the year that a person retires. Regardless of the total gross earnings for the year, a check can be paid for any month that gross wages earned in that month do not exceed the monthly limit, $1,950 in 2025. In the year you reach full retirement age, you can earn a higher amount. In 2025, it is $62,160. This amount can be earned between January 1st of that year and the last day of the month prior to your full retirement age. If you are under that amount, you are eligible to receive benefits starting in January, but they will be reduced by the number of months that you take it before full retirement age. Beginning with full retirement age, there is no limit on how much you can earn. You can find your full retirement age by looking at your Social Security statement online. At your full retirement age, if you don't take Social Security retirement earlier, you will get a full unreduced benefit. That benefit is based on the highest 35 years of your indexed earnings. Indexing means they give a current dollar value to prior year earnings. If you take your retirement benefit early, it is reduced. If your full retirement age is 67 and you take it early at 62, you will get about 30% less. Your Social Security statement shows you various options. If you delay taking your benefits past full retirement age, you receive delayed retirement credits of approximately 8% a year up until you reach age 70. When you file for benefits, other family members may be eligible too. A spouse, children under the age of 18 or up to age 19 if still in high school, and disabled children. Some people may be dually entitled to benefits, such as a widow who is also fully insured on her own work. You can find more information about benefits on the Social Security website. The two most often asked questions are, when should I start my Social Security benefits? And how do I file for my benefits? When to first start your retirement benefits is an individual decision. A financial planner can help you to make that decision. Things to consider are your health, your family longevity, your overall finances, and how much you like your job. Keep in mind that the earlier you take your retirement benefit, the less it will be. The longer you wait and the more you work and pay in, the higher it will be.
Hello everyone, my name is Stephanie Cedar. I am an insurance consultant at Robert Javens Financial Advisors, and today I am going to focus on sharing options for you regarding your health insurance as you plan for your retirement. When you are wanting to retire prior to being eligible for Medicare, exploring health plan options can be daunting. Most individuals have 3 options readily available to them. One option available for many is continuing their existing healthcare coverage through their employer via COBRA. This can sometimes be costly for some individuals. Another possibility is applying for health insurance through Penny. This is the only place that will link you to the additional financial savings to help lower your monthly payment and possibly out-of-pocket expenses. Others may choose to shop for health insurance directly through individual health plan carriers. Getting health insurance in retirement is often a roadblock that prevents people from retiring prior to age 65. Today, I will discuss health plan options available to you prior to turning 65, as well as provide you with an overview of the Medicare basics. We will begin by reviewing the different parts of Medicare and then dive into your Medicare options. As you near 65 and then annually around the open enrollment period, you'll receive lots of information in the mail. One reference material that you'll want to keep handy is the Medicare and You book. It is the official U.S. government Medicare handbook. The first step in understanding Medicare and your options is by learning about the different parts of Medicare. So what are the different parts? There are 4 parts that you'll want to keep in mind. The first is Part A. For this, you will think hospital. It helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. The second is Part B. Think doctor visits. This covers services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and preventative screenings. Part A and B together are called Original Medicare and is administered by the Center for Medicare and Medicaid Services. The third is Part C, which incorporates Medicare Advantage plans. And the fourth is Part D, which includes prescription drug coverage. Now that we've learned about the 4 different parts of Medicare, you may be asking, what do I need to do? Your first step is deciding whether you're ready to enroll in Parts A and B. If you have elected to enroll when you first become eligible and you're currently receiving benefits from Social Security or the Railroad Retirement Board, in most cases you'll automatically get Parts A and B starting the first day of the month you turn 65. Approximately 6 to 8 weeks before you turn 65, you'll get your Medicare card and your Welcome to Medicare package. If you decide to not enroll in Parts A or B when you first become eligible due to current employer healthcare coverage by you or your spouse, you'll want to be sure to delay your benefits by following the instructions in your package. First, make sure that your employer plan would be considered credible coverage for both Parts B and D. Your insurance company or employer should provide you with that information. In this example, many individuals elect to keep Part A if they receive it premium-free and decline Part B. It is very important to delay your benefits to avoid any late enrollment penalties. You'll receive a special enrollment period when your current credible employer coverage ends. If you are not currently receiving benefits, you have 2 ways to enroll in Parts A and B. You can enroll online or schedule an appointment to file over the phone by calling Social Security's toll-free number or your local Social Security office. There are 5 enrollment periods that I'd like to share with you. The first is the annual enrollment period. It takes place between October 15th through December 7th every year. This is a time when anyone with Medicare can make a change. The second is the open enrollment period, which occurs from January 1st through March 31st each year. During this time, anyone with a Medicare Advantage plan can make a change. The third enrollment period is for those aging into Medicare, which is often known as your initial enrollment period. It begins 3 months before your 65th birthday and ends 3 months after. Those not 65 will have a separate initial enrollment period. The fourth is the general enrollment period, which takes place between January 1st and March 31st, when you can enroll in Medicare Part B for the first time if you missed your initial enrollment period and do not qualify for the Part B special enrollment period. The fifth is a special enrollment period, which includes a variety of circumstances, such as a loss of credible coverage and/or moving outside of your existing service area. When you first enroll in Medicare and during certain times of the year, you can choose how you get your Medicare coverage. There are two main ways to get Medicare. The first is through Original Medicare, your Parts A and B, and then you can add on a prescription drug plan, also known as a Part D plan, and if you choose, you can add a supplement plan for additional coverage. And the second is through a Medicare Advantage plan, also known as a Part C plan. Let's discuss each of these in further detail. Medicare supplement plans are also frequently referred to as Medigap plans. They are sold by private insurance companies to help cover the 20% gaps in original Medicare coverage. They do not include things such as your Part D prescription drug coverage, vision, dental, or hearing. These portions are sold separately. Medicare supplement plans are standardized in 47 of the 50 states and are named by letters. All plans are identical across insurance carriers. The only difference is how much you pay in your monthly premium. Medicare Advantage plans, also known as Part C, include Parts A and B of Original Medicare. They are a healthcare option provided by private health insurance companies. Plans can differ in what they charge for services and premium amounts. They may also have lower out-of-pocket costs than Original Medicare, and many offer additional benefits that Original Medicare doesn't cover, such as dental, vision, hearing, and over-the-counter allowances and gym memberships. You can buy a Medicare Advantage plan, Part C, if you are enrolled in Parts A and B and live in the plan service area. Some people ask, why can't I just rely on Parts A and B? You can rely on Parts A and B, but it only pays about 80% of your healthcare cost, hospital and doctor visits, and only includes some drugs. As a certified insurance broker, I am happy to help you navigate the process, shop plans, and provide you with information needed to make a decision that will work for you.
We value the importance of building relationships with our clients. Maintaining lifelong relationships allows us to provide support in making the right financial and insurance decisions. Thank you for participating in this seminar. Contact us if you would like to schedule a personal consultation or if you have any additional questions.